This scandal is President Kenyatta's scandal. He must deal with it as such. He must tell the country what he knows, when he knew it, and what he did when he knew it. This scam is a continuation of what started with the NYS scandal, where again, family members and close confidants of the president were implicated as direct beneficiaries in the theft from the youth of Kenya.
Everybody in Kenya, irrespective of their relations, has a right to do business in Kenya as companies, as individuals. And nobody should be condemned.
It would be wrong for God Coalition to be just demanding and asking President Uhuru Kenyatta to either sack the CS and the PS or ask them to resign. In fact, the first person who should resign because he has failed to lead the country is President Uhuru Kenyatta, including his own government.
Our record as a government on matters dealing with corruption is as clear as the public understand. Every opportunity these issues have arisen, we have taken firm, decisive steps.
This latest scam is a scorched earth war on the most vulnerable in our population. Mothers on the verge of giving birth and babies just delivered or about to be delivered. The president cannot run away from this scam.
All right, those are the soundbite statements there coming from different politicians about the big C word, that is corruption. And gentlemen, we were speaking about very many different things, but anytime you're talking about health, you're talking about money. And for some reason, anytime you're talking about money in this country, there is always corruption, whether alleged or real, somewhere there. How have we dealt with this issue of corruption insofar as health is concerned in this country, Dr. Nyikao?
Well, I think we haven't dealt with it properly. And the one that is referred to in the news bite is definitely referring to the
Afia House. And
the
yes,
Afia
we will
House
speak about details in a moment.
and to the clinics. And you see, and then there was a report, that their own report that actually brought the issue. Now, my concern up to now is that we have not come out and look at this in details and come out and clear and say, this is the person who has fault and this is what we are going to do. And so long as we don't do that, the issues of corruption will remain. The clinics, for example...
Why can't we do that, Dr. Pokose? Do you even agree with him anyway?
I think before I come into that, before we broke it, there was the issue of conditional grant.
Which I will come back to in a moment, so that we don't lose this thought.
On the issue about corruption, I think our biggest challenge is the institutions that fight corruption. We have the EACC, and then you have the Directorate of Public Prosecution, which are the two institutions mandated to be able to fight corruption. To me, I think EACC as an institution has not done very well.
But Parliament too is a watchdog.
You know, yeah, fine. Parliament will provide
oversight. And I remember,
Parliament will provide oversight.
With respect, I remember when this issue of Afia House was happening, there was, especially with regard to the clinic, there was a problem in the committee. I mean, there was a real division. Well, some of them were accusing you and the chair of basically shielding the executive. But we got the sense that Parliament itself, at least the Committee of Parliament in this regard, could not even agree whether this was corruption or not, could not agree on what made sense and what did not. How do we even fight corruption when Parliament itself...
You know, one of our biggest challenges as a country is what we call sensationalizing of the information without getting our facts correct. Because for me as a vice chair and the chair, we must show leadership within the institution in which we lead. Let's get facts. We have our role as members of parliament is to provide oversight. We should be able to provide and say there's something which is wrong here, and we need action to be taken.
But the committee has not said that this many months later. We don't know what happened.
I think if you read even in the Standard newspaper, I think today or yesterday, about even the MES project in facilities where we've visited. We've said there are challenges, and we've been able to point out. Even in terms of the issue about about the purchase of these containers, the portable clinics, we went there and we said there are challenges, but we must be able to address those challenges. Where are these challenges? Because when you just throw people's names for political gains and start doing mob lynching.
When you say challenges, people will say this is public money. So when there is a problem, it's more than a challenge, Mheshimiwa. Someone ought to answer that this is the person who was responsible for either making wrong decisions about our money or misusing it, and this is what we recommend should happen to that person.
And those are the issues that we've raised as a committee. But you see, at times politics come into play, where individual wants to throw names. You see, all those people we want to throw names here and there. There are people who are respectable, there are people who have families, they have children. Let's throw a name with facts that we can be able to say so, and this is where the mistake is.
Dr. Nyikal,
well, I think here I must admit, my friend, that as a committee, we didn't really come out clearly and categorical. We were actually divided. Some of us, like me, thought there were things that were wrong that the executive needed to face. But we didn't.
E.g.?
What was wrong? The cost of the clinics. I don't accept up to now that those modified containers would cost 10 million. We went down to the cost and we looked at them. I had a list, my friend had a list, and we then said there are certain elements we would like costed to see if it comes to this. That really never happened. We expected the executive to do that. Even up today, those containers are still there, and the money has been spent. The money has been paid. There was issues raised. We have not sorted the issues.
But you went there and you raised those issues, but you didn't even agree as a committee that there was something wrong with the cost of the containers. In fact, some members of the committee said, this looks fine.
I've said and I've admitted that as a committee, we did not agree. And again, as he says, politics comes and it starts to look like now if you're in opposition, it is wrong. If you're in government, it is right. But I want to say that even if I were not in opposition...
So the committee was divided along party lines?
I think that was true, and I don't want to cover up that. We didn't agree. Myself, up to this point, I think there was something wrong. We should have come out and held the executive to account. You don't even have to say so and so. Instead of mentioning people's names, you actually have offices, and people who are holding those offices at the appropriate time attach the fault to the office, and the holder of the office at the time takes responsibility.
So, Dr. Pokosa, just break it down as simply as you can. What was, you call them challenges, but what was the problem with the purchase of those containers that we saw in Mombasa that supposedly cost 10 million shillings?
One of the biggest, the problem is that when we went there, we did the inspection first to establish the containers were there, because we had been told that there were 100 containers and one had already been brought to Nairobi. So we established that there were 99 containers which were there. Then the second is we went through the checklist to establish what are the contents of this. Are they all those items there? Were we able to see all of them? Yes, we saw the checklist. Myself and Dr. Nyikal and others were there. And then now from there, the next step was to get somebody to be able to do for us the costing, which we recommended, that we need to establish, are these containers really worth, and the contents that were there, are they worth the amount of money that was stated as having purchased them? And as much as, actually out of that meeting and establishing that there were irregularities, which we thought needs to be investigated by the appropriate agencies. As a committee, we stopped further allocations of money to the program, okay? Because the program had been allocated around 1 billion for the last financial year, which is now just elapsing. And the committee said, we are not going to approve that amount of money because this program, so far, we've not been able to get the value for money. The other issue is these containers having been brought there, they were supposed to be taken to the various places. Either they had to reach areas or slums within the urban centers. Then the question now came in, was the cost inclusive of taking them up to all those areas? While in that process, the EACC also came in, and I think they arrested those people who are, the person who had purchased those containers. They were questioned, and I think the process was stopped. Up to today, I don't think any further payments have been made.
But
by
I don't
the
see the
ministry.
level of outrage, because if the containers are still lying there, you say that they did not realize, we did not realize as a country value for money for the containers.
Yes.
No one, to the best of our knowledge, is really answering for this. And we are saying, well, we shouldn't mention people's names. Surely there ought to be someone, a real human being somewhere with a name, who ought to answer to the question of why did we lose value as a country? Why did we lose money out of something that is not even helping us now?
Let me just add. You know, it's right when he said that as a committee we said this project cannot go on, and we actually stopped the money. But in a way, that actually still puts that in the spot. If you know that the first project, you have said it was not done well, and for that reason we are stopping the payment. We are duty bound to say what is it that went wrong and who is it.
Exactly, that's my point.
So that I think.
So why didn't you do that?
I think that's where we
who
said.
Stopped you from doing it?
Now,
you are a committee of parliament.
We made the report, and as you said, this is where actually the differences came. And you know, some of us came in the public and said, this is not right, this should be done. And I think the rest is obvious. But I want to stay up to now that that particular element in the health expenditure, I think there was an element of corruption, and we still eventually, if we get back to Parliament, this is something, my colleague, we may have to still just go and look at. And let me say, if we people in NASA take up, you can be sure this thing will be opened up. Like it is likely this thing will be opened up. And even the managed equipment program.
I'll come to the managed equipment in just a moment. Yes, Mheshimiwa.
You know, Joe Akeo, in this country, even before the current parliament, in the other parliament, there was the issue of clinics and Meridian. It is taken as more than 10 years for EACC to investigate it and conclude. When these containers, when they were brought there, EACC moved with a lot of speed, with a lot of even people showing them cameras when they have gone to Afia House to get reports and be able to do the investigations. Okay? But I think there is a problem in this country because EACC and DPP, because before DPP gets this report and be able to institute prosecution, EACC has to conclude its investigations. But I think there is a problem with EACC. EACC seems to be taking ages because clinics issue is not resolved up to today. Meridian issue is not resolved up to today. When those containers were brought and they were in the port of Mombasa and these issues came up, EACC rushed very fast. They collected the files, collecting all the documents, but look at it up to now. Has anybody been prosecuted?
But it's all very good, Mheshimiwa, for members of parliament to accuse EACC of all manner of things and throw their hands up in the air and say there's nothing we can do because it is the EACC. Yet there are many instances where Parliament has actually moved to send commissioners home when they were unhappy about something. Most of the cases when some of their colleagues were actually mentioned there. Are you saying that Parliament as the representative of the people cannot do anything about the EACC?
Let me come to that. I mean, again, my friend, if we take an institution or institutions within a government and accept that this institution hasn't done its job. There must be somebody where the buck stops. And I think the executive, right up to the presidency, has the power, and in particular in Jubilee government, with the control in parliament, with the numbers, we can actually do that. And remember, there was a time when we were actually looking at removing people at ARC. I think even the one of the executives, we felt this person should actually leave. And remember, there was a move by one of the opposition coalition that said this person should actually leave. It went to the vote in parliament, and again, the tyranny of numbers, this person was saved. And we cannot just say that there wasn't enough information. Look at what we did when there was the famous report of the president. Some people were just merely named as under investigation. Some of these people went home. Even these investigations, that after they went home, step aside, it will be investigated and facts will come, they have not come out. I think, I will say that the corruption is rampant in the country. So many people are in it that it is difficult to get into it. But the government in power must put its foot down and say, here, the buck stops with us. We have majority in parliament. If we need parliament to remove certain offices and certain, we will do it. And you know that whenever the Jubilee government has felt that something needs to be done through parliament, it has always worked because the numbers that are there. So I know it's a national problem, but as of now, the Jubilee government must take responsibility.
I know my colleague would want to blame it on the Jubilee government, but
who do you blame it on?
One of the things that we should realize is that under the new constitution, we have institutions that are tasked with the various functions. It's not the president to go and carry out investigations. EACC must, you know, when there is an issue like this of corruption, surely would we want the president to come and do the investigations? It's not. And the only issue that has always come up is you want to say it stops with the buck stops with the president. But the constitution has given various institutions their responsibilities. If the institution is not able to perform that responsibility, then it does not stop with the president. It is not the president to sack. It is actually it should be the responsibility of parliament. And the parliament is both those who are in the opposition, the minority. In fact, we have no opposition in parliament. It is those who are in the minority and those of us who are there, or in the majority. All of us must take responsibility. I think, to me, I would look at it as a failure of parliament, not a failure of the president.
But the minority will have their say. The majority will have their way. Mm-hmm. And that's how it goes. So really, my friend, on this one, the majority must have their way and take the responsibility for this. Because even we know that there are institutions below the presidency. But all these institutions, if we look carefully, starting with parliament itself, if you have control of parliament through numbers, there is a lot of, you know, there are times that when things got tough, actually in our various party leaderships, we've been called out and decisions have been made, and this is how it's going to be, both in Jubilee and in court, and we've come back and you can see that this is a decision that was made as leadership of this, of the majority, of the minority. But
you see, when you say, that we put it right, huh? You say the minority will have their voice.
Yeah.
Okay. And the majority will have their way.
Hey.
And the minority having that voice means they can even give a dissenting voice. Have we gotten anything descending from the minority?
We have.
To say now,
we have.
This is how we feel this thing should be done.
We have. Let me just say, there are many cases that we have actually got dissenting voices. There are cases that the minority have walked out of parliament. And in this particular case, you know that I actually stated that I do not agree with the position the committee is stating. It is in the record. So
Okay, we will continue in a moment. You want to right now go to my colleagues Hassan Juma and Zinze Kibiku. They've been following discussions online, trying to figure out what exactly are people saying out there. We've been asking all evening where people get their medical services from. And Zinze and Hassan, I wonder what people are saying out there about the discussion we are having and also just the state of the health sector in the country.
Well, Joe, people are definitely following the conversation, and we're keeping an eye on that using the hashtag Kivumbi 2017. A lot of people also indulging us in what they do when it comes to seeking medical health care here in Kenya. Do they go to private or public hospitals? Do they see a herbalist? Do they pray? What do they do? So Kenyans have really been active on that forefront area, Joe. But first of all, Hassan, look at the percentage when we asked tonight, where do you seek your medical attention from? 53% say private hospitals.
24% public hospitals.
And 13% said self-treatment. And another 10% herbal treatment. That's where the likes of Hassan fall in place. Okay, so let's take a look at now, or rather, let's just go to the profile right there. We're going to take a look at now at some of your comments, especially if you went and you voted. Remember, we were also live in Nakuru earlier on where we had actual voting happening. But leave alone that as that was happening, we are not forgetting our online team, and we're making sure that we're remembering that. There you go. So let's just come there. Okay, take a look at this. These are just some of your comments that have been flowing throughout the show, Hassan.
Yes, Naf says I think it's feasible with some diligence and accountability to provide the universal health cover for all Kenyans, like the UK's NHS.
Ronald Rotich is very, very vocal about this. He says 5 billion from Afia House scandal, 2.4 billion in illegal expenditure, 889 million of free maternity health care, and another 551 million of AIDS control lost. All right, so that's where we are as a government, or rather as a country, when it comes to our state of the health care. Kivumbi 2017, that's the hashtag that we're using. Government needs to be serious with the Kenyan health system, as this can change to be a point changer in this election. All right.
That's true.
Hassan?
Samuel N. Orutwa, having a dog in hospital without drugs and facilities is like having a cook without food. To cook, the government must play their part.
Okay, so those are just some of the comments that we've been receiving throughout the show as we have been talking, or rather putting Kenya's state of health, on the spotlight in regards to that. So yes, a lot of comments have been streaming in regards to that. Let us see what else we have. Okay, there's one tweet here by Samuel. Samuel, you say when health services are devolved, they did not improve the health of the people, but to run for the representative. All right, so that's in regards to devolution. If there's some of the tweets that we've seen in regards to devolution, is the fact that very many people are saying that health shouldn't have been devolved. What do you think? So make sure you're tweeting us using the hashtag Kivumbi 2017.
Joe?
All right, thank you very much, ladies and gentlemen. It's time to go to bed, and I'm sure Zinzi is waiting for that. But gentlemen, let's take this home. We are running out of time, but I cannot leave without talking about the health bill, which a lot of people think might solve some of the problems. To begin with, devolution, and many people have been asking for independent commission, for example, to deal with health matters in the country in the fashion of, say, for example, the Teacher Service Commission. What is provided for in the bill is sort of an advisory council or something. But how close does this proposed legislation take us to where our health needs to be? Dr. Pokwasa.
You know, in the beginning, there was something we were to talk about, the conditional grant, if you can allow me just 1 minute. Okay. Because it is very important. Conditional grants is money that is given to the level 5 hospitals. You're talking of former provincial general hospitals. Unfortunately, this money has not been ring-fenced. It has just been going to the county governments, and the county governments have just been using it and releasing in small bits to those facilities, that it has not achieved what it was meant to be done. So for me, I think the way forward for us as a country to go is to ring-fence that conditional grant, so that as it goes to those facilities, it must go as the, let's say if we appropriate 300 million to Nakuru Provincial General Hospital, that 300 million should be released to Nakuru Provincial General Hospital, not necessarily going through the county government. And that way, it will be able to achieve what it was meant to. Because when you release it to the county government, then the county government now will have other priorities to deal with before releasing the amount of money to that facility. And we went to one of those level 5 hospitals, and which had been appropriated 300 million. And the governor had put that money in a special account to start another teaching and referral hospital, which I think is a very unfortunate thing. Coming back to the health bill, one of the biggest challenges that as a health sector we never foresaw was to have a health service commission that would have actually addressed these issues that we are now facing, the issues of nurses, doctors, and every healthcare worker asking for maybe transfer from one county to another, promotion, training, remuneration, how to their personnel emoluments and everything, just like the Teacher Service Commission for the teachers. That was a big mistake that we made. And I think, just as Dr. Machake talked, I think that is the elephant in the house for the healthcare services. And when you look at the health bill, we've come up with an authority, which we agreed, both with the Senate. We also agreed with the Council of Governors, that let's have an authority that would be able to address all these issues to do with staffing issues, issues of promotion, issues of training, and all that issues of even negotiating with the Salaries and the Remuneration Commission in terms of how to see their salaries, issues of even posting after the training of interns. You see, like even as we speak today, the interns have, for the 100 days which they were even on strike, they have not been paid their salaries up to today as we speak. And nobody is addressing even that issue. After now we even have interns.
Do you think this new authority, this human resource...
Should be able to address, yes. Even now we have interns who have completed their internship training, but they have not been posted. How do you, who addresses them? Who knows that which county requires doctors, this number of doctors? So you need an authority that can be able to say, Marsabit, how many doctors do you require? Transoya, my county, how many doctors do you require? Then once this, and they know that we have this number of interns who are going to graduate this year, so that immediately interns graduate, then they are posted to provide services in the various hospitals within the various counties. So,
Dr. Nyikal, before we wrap up.
Well, I think the health bill as we have is actually going to help us if we go by it. Look at the human resource area, and as my colleague has said, and correctly so, we are going to now have a standard. You must have a standard in all areas, whether it is human resource, whether it is commodities, but the human resource is the one that has been most difficult. And actually, in the referendum which actually failed, there was a Health Services Commission there. This one didn't put it in. We have put it as advisory because that will be in line with the Constitution as it is now. Otherwise, we'd have to go for a referendum to change that. But even having said that, it will still give very clear guidelines on how you deal with human health resource at various levels, you said, training and so on. So that if you're an intern, as I said, in Migori, you go under exactly the same conditions as an intern in Nijara. Now, the national government, as we put it, does not have to do that, but the law now allows the standards to be set. If you now want to take a county to task that you are not doing it, you are not managing your human resource appropriately, you have something that will be the same for everybody. But the health bill has other aspects. Even the regulation of all the professionals within, we have had about over 20-something acts dealing with the various cadres, the area professions. Now we put some authority again that puts them all together and provides that how they can all be coordinated and linked this with the county government, so that even the authorities, the work of the directors.
All right,
let me just tell you.
We have to go.
The work of the directors.
Oh, okay, 10 seconds.
Even the work of the directors at the county, we have a clear guideline. But those 10 seconds, I would say, the national government and the county government must sit together and get this nurses strike resolved. We cannot sit. People are dying as many as they died in Westgate. And we must react with the same passion and the same strength. I think the president at least can call the cabinet secretary in treasury, cabinet secretary in health, and the cabinet secretary in labor. These people can solve this problem.
All right.
We can't go on with the strike.
And on that optimistic note, we end Kivumbi 2017 for this Monday, the 12th of June 2017. Remember, we'll be back here next week on Monday, same time, starting 6 p.m. to give you perspectives that will be guiding these conversations towards August 8th, which is now just 56 days away. Do have